Welcome to Graceful Years, where we explore practical ways to live your best life at every age. I'm here to share evidence-based strategies that can help you thrive, not just survive, through life's changes. Today, we're tackling a challenge that affects millions of people worldwide: joint pain. Whether you're dealing with arthritis, age-related wear and tear, or occasional stiffness, you don't have to rely solely on medications to find relief. In the next 20 minutes, we'll explore natural, scientifically backed approaches to managing joint pain that you can start implementing today. These strategies focus on empowering your body's own healing abilities while improving your overall quality of life. Before we begin, I want to emphasize that while these methods are effective for many people, it's always important to work with your healthcare provider, especially if you have chronic conditions or are currently taking medications. Think of today's discussion as tools to add to your wellness toolkit, not replacements for professional medical care. Understanding joint pain. Let's start by understanding what's actually happening when your joints hurt. Joint pain typically occurs when the smooth cartilage that cushions your bones begins to wear down, or when inflammation builds up in the surrounding tissues. This can happen due to age, overuse, injury, or autoimmune conditions. The good news is that your body has remarkable healing capabilities. When we support these natural processes through lifestyle changes, movement, and targeted strategies, we can often reduce pain and improve function significantly. Many people assume that joint pain is just something they have to live with as they get older. While some changes are natural, the intensity of pain and its impact on your daily life can be dramatically improved through the approaches we'll discuss today. The key is consistency and patience. Unlike a pill that might provide temporary relief, these natural methods work by addressing the root causes of inflammation and supporting your body's long-term health. This means the benefits often build over time and become more sustainable. The power of gentle movement. One of the most counterintuitive but effective approaches to joint pain is movement. When joints hurt, our instinct is often to rest them completely. However, gentle, appropriate movement is actually one of the best medicines for joint health. Let's talk about why movement helps. When you move your joints through their range of motion, you're essentially lubricating them. Your joints produce synovial fluid, which acts like oil in an engine, reducing friction between bones. Without regular movement, this fluid becomes less effective, and joints can become stiff and more painful. The key word here is gentle. We're not talking about high-impact exercise or pushing through severe pain. Instead, focus on movements that feel good and gradually increase your range of motion over time. Water-based exercises are particularly beneficial. The buoyancy of water supports your body weight, reducing stress on joints while still allowing for full range of motion. Even if you don't have access to a pool, a warm bath can provide similar benefits for stiff joints. Walking remains one of the best exercises for joint health. It's low impact, accessible, and you can adjust the intensity to match your comfort level. Start with just 5 to 10 minutes if that's what feels manageable, and gradually increase as your joints adapt. Stretching and flexibility work are equally important. Gentle yoga, tai chi, or simple stretching routines help maintain joint mobility and can reduce stiffness. These practices also incorporate breathing techniques that help manage pain perception. Range of motion exercises can be done anywhere and don't require special equipment. Simple movements like gentle neck rolls, shoulder shrugs, ankle circles, and knee lifts can make a significant difference when done consistently. Remember, the goal isn't to eliminate all discomfort during movement, but to distinguish between the good hurt of gentle stretching and the bad hurt that signals potential injury. Always listen to your body and stop if you experience sharp or severe pain. Nutrition for joint health. What you eat plays a crucial role in managing inflammation and supporting joint health. While there's no single arthritis diet, certain foods have powerful anti-inflammatory properties that can help reduce joint pain over time. Let's start with omega-3 fatty acids, found in fatty fish like salmon, mackerel, and sardines. These healthy fats help reduce inflammation throughout the body, including in your joints. If you don't eat fish regularly, walnuts, flax seeds, and chia seeds are excellent plant-based sources. Colorful fruits and vegetables are packed with antioxidants that fight inflammation. Berries, cherries, leafy greens, and brightly colored vegetables should be staples in your diet. Tart cherry juice in particular has been shown in studies to reduce markers of inflammation and may help with pain management. Spices can be powerful allies in your fight against inflammation. Turmeric, which contains curcumin, has been extensively studied for its anti-inflammatory properties. Adding a pinch of black pepper enhances its absorption. Ginger is another potent anti-inflammatory spice that's easy to incorporate into meals or teas. On the flip side, certain foods can increase inflammation. Processed foods high in sugar, refined carbohydrates, and trans fats can worsen joint pain. This doesn't mean you need to eliminate these foods entirely, but being mindful of your intake can make a noticeable difference. Hydration is often overlooked but crucial for joint health. Your cartilage is about 80% water, so staying properly hydrated helps maintain its cushioning properties. Aim for clear or light yellow urine as a simple hydration check. Some people find that certain foods trigger their joint pain. Common culprits include foods high in purines, which can worsen gout, excessive dairy, or foods from the nightshade family like tomatoes and peppers. Keeping a food diary can help you identify personal triggers. Weight management, while sensitive to discuss, is important for joint health. Every pound of body weight puts about 4 pounds of pressure on your knees. Even modest weight loss can significantly reduce joint stress and pain. Heat and cold therapy. Temperature therapy is one of the oldest and most accessible pain management tools available. Both heat and cold can be effective, but they work in different ways and are best used in different situations. Heat therapy works by increasing blood flow to the area, relaxing muscles, and reducing stiffness. It's particularly effective for chronic, achy pain and morning stiffness. You can use a heating pad, warm towel, warm bath, or even a rice sock heated in the microwave. The key with heat therapy is gentle warmth, not scorching temperatures. Apply heat for 15 to 20 minutes at a time, and always have a barrier between the heat source and your skin to prevent burns. Heat works especially well before activity to help loosen stiff joints. Cold therapy, on the other hand, reduces inflammation and can numb acute pain. It's most effective after activity or when joints are swollen and inflamed. Ice packs, cold compresses, or even a bag of frozen peas wrapped in a towel can provide relief. Like heat therapy, limit cold application to 15 to 20 minutes to prevent tissue damage. Never apply ice directly to skin, and remove it if the area becomes numb. Some people benefit from contrast therapy, alternating between heat and cold. This can help reduce inflammation while maintaining mobility. Always end with the treatment that feels best for your specific situation. Warm baths with Epsom salts combine heat therapy with magnesium, which may help relax muscles and reduce inflammation. This can be particularly soothing before bedtime. Stress management and sleep. The connection between stress, sleep, and joint pain is more significant than many people realize. Chronic stress and poor sleep can increase inflammation in your body, making joint pain worse and harder to manage. When you're stressed, your body releases hormones like cortisol, which can increase inflammation over time. Additionally, stress often leads to muscle tension, which can put additional strain on already painful joints. Developing healthy stress management techniques isn't just good for your mental health. It's essential for managing physical pain. Deep breathing exercises, meditation, and mindfulness practices can help break the stress-pain cycle. Progressive muscle relaxation is a technique where you systematically tense and then relax different muscle groups. This can help you become more aware of tension you're holding and learn to release it consciously. Sleep quality directly affects pain perception. When you don't get adequate restorative sleep, your pain tolerance decreases, making joints feel more uncomfortable. Poor sleep also interferes with your body's natural healing processes. Creating good sleep hygiene is crucial. This means keeping your bedroom cool, dark, and quiet, avoiding screens before bedtime, and maintaining consistent sleep and wake times. If joint pain keeps you awake, experiment with pillows or supports to find comfortable sleeping positions. Some people find that gentle stretching or relaxation techniques before bed help reduce morning stiffness. However, avoid vigorous exercise close to bedtime as it can interfere with sleep. The mind-body connection in pain management is powerful. Techniques like guided imagery, where you visualize healing and comfort, can actually help reduce pain perception. While this might sound too simple to be effective, research supports these approaches as valuable tools in pain management. Natural topical treatments. Topical treatments applied directly to the skin over painful joints can provide localized relief without the systemic effects of oral medications. Many natural options are available and can be quite effective. Capsaicin, derived from chili peppers, works by depleting substance P, a chemical that transmits pain signals. Capsaicin creams are available over the counter and can be particularly helpful for arthritis pain. Start with a small amount and wash your hands thoroughly after application to avoid accidentally touching your eyes. Menthol-based creams provide a cooling sensation that can temporarily override pain signals. These are often combined with other ingredients like camphor or eucalyptus oil for enhanced effect. Arnica is a traditional remedy that some people find helpful for joint and muscle pain, particularly after minor injuries. While the scientific evidence is mixed, many people report benefits with minimal side effects. Essential oils like eucalyptus, peppermint, or lavender can be diluted in a carrier oil and massaged into painful areas. The massage itself provides benefits by increasing circulation and providing human touch, which can be therapeutic. Always test topical treatments on a small area of skin first to check for sensitivity reactions. Some people may be allergic to certain plant-based ingredients, and it's better to discover this with a small test application. Remember that while topical treatments can provide symptom relief, they're most effective when combined with other approaches like movement and nutrition changes. Section 7. Creating your daily routine, 1630 to 1830. The most effective approach to managing joint pain naturally involves creating sustainable daily habits rather than relying on occasional interventions. Let's talk about how to build a routine that supports joint health throughout your day. Start your morning with gentle movement. This doesn't have to be a formal exercise routine. Simple stretches in bed, slow movements to warm up your joints, or a few minutes of walking can set a positive tone for the day. Consider your daily activities and how you can modify them to be more joint-friendly. This might mean taking frequent breaks if you sit at a desk, using ergonomic tools, or breaking large tasks into smaller, manageable segments. Throughout the day, pay attention to your posture and body mechanics. Poor posture can put unnecessary stress on joints, while good alignment can help distribute weight and forces more evenly. Evening routines are just as important. This might include a warm bath, gentle stretching, or relaxation techniques that help your body wind down and prepare for restorative sleep. Consistency is more important than perfection. It's better to do a little bit every day than to have perfect days followed by days where you do nothing. Your joints benefit from regular, gentle care rather than sporadic, intense efforts. Keep a simple journal tracking your pain levels, activities, and what seems to help or hinder your comfort. Over time, you'll likely notice patterns that can help you fine-tune your approach. Be patient with yourself and the process. Natural approaches often take time to show their full benefits, unlike medications that might provide immediate relief. However, the improvements you achieve through lifestyle changes are often more sustainable and come with additional health benefits. Build flexibility into your routine. Some days you might feel great and want to do more, while others might require gentler approaches. Learning to adjust your activities based on how you feel is a valuable skill in long-term pain management. When to seek professional help. While natural approaches can be incredibly effective for managing joint pain, it's important to recognize when professional help is needed. Some situations require medical evaluation and intervention. Seek immediate medical attention if you experience sudden, severe joint pain, especially if it's accompanied by fever, significant swelling, or inability to use the joint. These could be signs of infection or serious injury. If your joint pain is progressively getting worse despite consistent natural management efforts, it's time to consult with a healthcare provider. They can help determine if there are underlying conditions that need specific treatment. Persistent pain that significantly interferes with your daily activities, sleep, or quality of life shouldn't be something you just endure. Healthcare providers can offer additional tools and treatments that complement your natural approaches. Consider working with various healthcare professionals who can support your natural pain management goals. Physical therapists can teach you specific exercises and techniques tailored to your situation. Registered dietitians can help optimize your anti-inflammatory eating plan. Massage therapists can provide hands-on treatment that complements your self-care efforts. Don't view natural approaches and medical treatment as mutually exclusive. The best pain management often involves combining evidence-based natural methods with appropriate medical care when needed. If you're currently taking medications for joint pain, work with your healthcare provider before making any changes. They can help you safely integrate natural approaches and potentially adjust medications as your symptoms improve. Managing joint pain without medication is not only possible but can lead to improvements in your overall health and well-being. The strategies we've discussed today, gentle movement, anti-inflammatory nutrition, temperature therapy, stress management, good sleep, natural topical treatments, and consistent daily routines, work together to support your body's natural healing abilities. Remember, the goal isn't to eliminate every twinge of discomfort, but to reduce pain to manageable levels while maintaining an active, fulfilling life. Small, consistent changes often lead to significant improvements over time. Start with one or two approaches that resonate with you most. As these become habits, you can gradually add other strategies. The key is finding what works for your unique situation and lifestyle. Your joints have served you well throughout your life, and with proper care and attention, they can continue to support your active lifestyle for years to come. Be patient with yourself, stay consistent, and celebrate the small victories along the way. If you found today's information helpful, please give this video a thumbs up and subscribe to Graceful Years for more evidence-based strategies for healthy aging. I'd love to hear about your experiences with natural pain management in the comments below. Your insights might help others in our community who are dealing with similar challenges. Until next time, remember that aging gracefully isn't about avoiding all discomfort, but about having the tools and knowledge to manage life's challenges while continuing to thrive. Take care of yourselves, and I'll see you in the next video.